Welcome to the Incident Management System Training. Following this video, we expect that you will be able to describe the goals and priorities of the Incident Management System, define what an incident is, understand the responsibilities of managed care entities or MCEs in incident management activities, and be able to successfully execute the incident management documentation process. The Ohio Department of Medicaid is focusing on the individual rather than the business of managed care. We want to do better for the people we serve. The incident management system is in place to assure the health and safety of all members by reducing the members' risks, preventing future harm, remedying discovered deficiencies in operating practices, and improving services for all members. First, we need to understand what an incident is. An incident is an alleged, suspected, or actual event that is not consistent with the routine care of and/or service delivery to a member that may have a negative impact on the health and safety of the member. ODM aims to assure health equity, which is the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. ODM expects all CMEs to engage in person-centered planning, which is a process directed by the member that identifies their strengths, values, capacities, preferences, needs, and desired outcomes. Person-centered planning includes team members who assist and support the member to identify and access medically necessary services and supports needed to achieve the member's defined outcomes in the most inclusive community setting. The member and team collaboratively identify goals, objectives, and interventions to achieve outcomes which are documented on the person-centered services plan by the case manager. ODM aims for trauma-informed care principles by approaching members' healthcare needs in a manner that takes into account any trauma they may have experienced. It is important to recognize trauma's lasting adverse effects on the member's function and mental, physical, social, emotional, or spiritual well-being. A trauma-informed care approach fully integrates knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. ODM also aims to ensure that collaboration occurs with other entities to reduce fragmentation and inefficiency and create transparent and effective processes that focus on the members. When thinking about incident management activities, it is important to know the responsibilities of the MCEs. The MCE is responsible for providing onboarding and ongoing training for MCE care coordination staff. The MCE will work with other care coordination entities and programs, including Ohio RISE, to conduct incident reporting and develop prevention plans. The MCE is required to follow the 1915C and 1915I waiver incident management requirements. The MCE is also responsible for reviewing incident data to inform the level and type of care coordination needed by the member. Remember, these responsibilities are all to ensure members' health and safety and to prevent future incidents. When an incident occurs, the managed care entity is responsible for reporting the incident into the Ohio's incident management system. Let's walk through how to do that now. From the IMS home screen, you will see specific dashboards for your agency. Using the tabs located at the top of the home screen, you can enter in new cases, search for existing cases or members, run reports, review your tasks, or access training resources through the Help tab. To enter a new incident or case, you will need to click on the Cases tab. From there, click on the New button. Once the new case screen has populated, you will need to document the incident in detail, starting with entering information about the member into the form. By utilizing the recipient search button on the top right corner, you will be able to look up a member and the information will autofill these fields. Now that your member's information is populated, enter the case and reporter information into the form. If the incident has appeared as a story in the news, be sure to select the Media Reported button. In the narrative text box, clearly but briefly describe the incident. Here is an example of an incident narrative. The member called the care manager on July 3rd and said that she had left her boyfriend and no longer lives with him. She is now living with her sister at her apartment. The member reported that she left her boyfriend's apartment on July 2nd because he was being verbally and physically abusive. The member reported that her boyfriend drinks alcohol heavily daily and also uses illegal drugs. The member reported that she had enough when on July 2nd he was drunk and threw a plate at her. The member sustained no injuries. The member said she called the police, and when they responded to the call that evening, they encouraged her to leave the home. After you complete the incident case narrative, enter the reporter information. The reporter information identifies how you found out about the incident. It may be from the member, the family, the provider, etc. Now, select the appropriate incident category from the drop-down menu in the form. If there are multiple incidents that occurred at the same time, select the red Add Incident button to report any additional incidents on the same case. If the alleged person responsible or alleged violator is known, add their information into the form. Be sure to include their last name and relationship to the member. If the alleged violator is a provider, please be sure to include the provider's Medicaid ID number. After you finish documenting the incident details, be sure to document the actions taken to assure immediate health, safety, and welfare of the member. Document this very important information in the appropriate IMS text box. Then select all the applicable checkboxes for actions done to address immediate health, safety, and welfare. Here is an example of an immediate health, safety, and welfare narrative. The care manager talked to the member on July 3rd using trauma-informed care principles. The member reported that she is currently safe. The member is now currently living with her sister. The member will live with her sister until she can obtain new housing. The member reports that she feels safe at her sister's apartment. The member has her current prescription medications with her that will last through the month. Next, you will add information on which agencies were notified about the incident under the Notification to Agencies section by selecting the agency or agencies that were notified within the Available box, and then clicking on the top arrow to move it to the Selected box. If you have added an agency in the Selected box by accident, you can easily remove it by selecting the agency name and then clicking the bottom arrow to move it back to the Available box. Once you have selected the available agency or agencies, click the Add button when done. Please upload any documents applicable to the incident, such as police reports, provider documentation, service plans, case notes, or investigation notes in the IMS. You can easily do this by clicking on the Upload Files from the Related Case tab, or you can just drag and drop documents in the Files section of the IMS. The next important step is to document the contributing factors or root causes in the text box. Then click on all the applicable categories. Contributing factors or root causes describe why something happened. The process is sometimes called the 5 whys. Contributing factors or root causes help you figure out what is really going on and can help you avoid quick fixes or just putting a Band-Aid on the problem. Lastly, describe the prevention plan for the incident in the text box. Think about strategies in a prevention plan that can help add another protective layer for the Medicaid member. Often, systems and processes have holes, just like Swiss cheese, that when lined up can lead to health and safety risks for our Medicaid members and may lead to very adverse outcomes. Here are some examples of a prevention plan narrative. When you are done describing your prevention plan narrative, click and check all the appropriate categories of interventions that are part of your prevention plan. By developing person-centered prevention strategies, future incidents can be prevented and will meet our goal to keep members safe and healthy. We need to effectively prioritize the events, hazards, and vulnerabilities in a member's system of care to accomplish the real objective, which is to understand what happened, why it happened, and then take positive action to prevent it from happening again. The prevention plan is developed in partnership with the individual. The strategies specify what the care manager will do to assist and support the individual. The strategies need to be person-centered, effective, realistic, and address the root causes. When the prevention plan is documented, you can close the case by clicking on the Close button. Please utilize the following checklist to ensure you comply with the incident management system requirements. Now, let's take a short quiz to test your new knowledge. Question number 1. What types of incidents are required to be reported? The answer will be shown in 5 seconds. The correct answer is A. Abuse, neglect, exploitation, misappropriation over $500, and accidental or unnatural deaths. Question number 2. Incidents are required to be reported in which ODM system? The answer will be shown in 5 seconds. The answer is D, the Incident Management System, IMS. Here is the final question. What is the purpose of incident reporting and management? Check all that apply. The answer will be shown in 5 seconds. And the answer is all of the above. The purpose of incident reporting and management is to assure the health and safety of all members, identify opportunities for improving systems of care, remediating risks to the member, and preventing future incidents. Through this incident management system training video, you should now be able to describe the goals and priorities of incident management, define the definition of an incident, demonstrate the MCE's responsibilities for incident management activities, and be able to successfully execute the incident management documentation process. For more information about the incident management system, visit the Ohio Department of Medicaid website at medicaid.ohio.gov. Submit all questions through the external MCE Q&A tracker that is located on the general channel of the ODM team site. Thank you.